Dear, good morning. Thankfully I saw your message the first thing in the morning today, so I'm going to reply this. First of all, I don't want you to panic. Okay, I want you to tell your mom and you also just relax. Don't worry about it. Okay, 9 months old baby, infant we call it. Okay, so infant when they poop and they have blood, it can be fresh blood, it can be a bit of dry blood, it can be also mucus streaks. Dia macam lendir berdarah. Okay. Now, there are a few things that we need to note from here. Number one, it can be constipation. Okay, formula fed children will tend to have constipation, and by 9 months old, they should be taking water already, right? But some infants, they don't really like water, right? So they still depend on milk as a source of hydration. Okay, so we call it protein milk allergies. Okay, the first one lah, constipation. So when the child, every time the baby, your brother drinks the milk, there's constipation, and then when he poops, there will be blood streak that comes out. That's why when you notice when you give food or you give solid like rice, the thing doesn't happen or it's reduced. Okay. Number two can be milk allergy, protein milk allergy in formula fed infants. Sorry, I still sengau and my ears is blocked. Okay, so sometimes patients ask me, Doctor, I've been giving the same formula milk for so long. Why suddenly the allergy? We also don't know. But children can develop allergy from the same milk that they have been drinking, which is contohnya the cow's milk. Okay, so suddenly they develop allergy, and if they are already on solid, we will stop the milk first. Okay, when we reintroduce a new milk, either goat's milk or soy based, we won't do it immediately as well, because we need to clear the blood streaks first. When you give the soy milk and then the baby is still having blood in the poop, okay, we are afraid, we don't know whether it's the balance from inside or is it from the new milk as well. So normally we won't introduce any new milk at the moment. So since 9 months old, baby can eat solids, and for hydration can depend on water. Okay, the reason baby is admitted is that the third reason can be a stomach, or we call it gastrointestinal infection. Okay, so during an infection, the baby will be admitted. One, they want to do a blood test. They want to see the total white cell count. So if it's a bacterial, the total white cell count will be a bit highish. If it's high enough that baby requires antibiotics, then they will give IV antibiotics, okay, for baby. All right, and if they feel that the hydration is low, they will also give IV fluids for the baby. They will make sure baby is stable, because the fourth one, even dehydration, when baby is eating solid and only drinking milk but not drinking enough water, can also lead to the bloody stool. Okay, right. So another thing that they want to monitor is that they want to monitor, very important for babies or infants, is that we want to monitor hydration status. We want to monitor the blood cell, and also third thing, most probably they want to do an ultrasound. Okay, ultrasound of the stomach or abdomen, we call it. Okay, the reason we want to do, just to make sure there are no other abnormalities that might be causing it. Okay, the least common thing that might actually occur, a lot of people don't know, babies, infants, toddlers can actually have gastric. Okay, so gastric, which can cause some bleeding in the lining of the stomach, which will come out through the stool. Okay, gastric for children comes from, sometimes their stomach is a bit sensitive, they can't take acidic food, or drinking milk too fast. Especially sometimes boys, they're very gelojo, okay, without breathing. So when the milk goes too fast, even during breastfeeding, so when they drink the milk, it goes too fast, it hits to the back, and then when it goes down, it can actually cause reflux. Okay, so these are the symptoms that actually, these are the reasons that it can happen. It is actually very common, nothing to worry about. Just monitor if baby has diarrhea. Okay, if the poop is coming together with diarrhea, then normally I say when you give rice or solids, please avoid vegetables and also avoid fruits, because they are all fiber and they can worsen the diarrhea. And in the meanwhile, also avoid anything that's acidic, like oranges, mango, that kind of thing. Just give normal rice, carrot, potato is already enough for children. Ikan bilis, okay. Normally children, we don't really give that much of meat, okay. Fish or like salmon, high in omega-3 is good for recovery. Okay, if baby has started, your brother has started on egg, you can also give egg, because egg it's wound healing. If there is wound healing in the stomach lah. Otherwise, should be okay. Don't worry. Talk to your doctors. They will always explain. Pete's doctors are one of the best doctors anywhere. They will tell you everything that they ask. Okay, they won't tunjuk muka and everything. Okay, because they know how difficult is it to have a toddler or baby or infant that is unwell. Okay. Other than that, what else to monitor? Please do not introduce any new food or milk again. Let me remind, until you discuss with your doctor or until baby is fully recovered. Only give whatever that has been given. Something else that I want to say. What is it? I think that's about it. I think. Yeah. Okay. Alright. Don't worry. Take care. Send you my regards to your mom, and I wish speedy recovery to your baby brother. Okay. Take care, my dear.